Welcome once again, distinguished ladies and gentlemen. On today's Healthy Living Counselor Health Education, we are going to be specializing on the World Kidney Day, and this education is going to be, yes, just like I've mentioned, in commemoration of World Kidney Day. Remember that Healthy Living Counselor Health Education is always brought to you by Interseed Health Products, IHP. And then this company produces herbal medicine that is 100% natural for improvement of human health. My name is Edith Ezema, and I will be your moderator for this event. Today, we are asking a very important question, and that question is, are your kidneys okay? Many people, including myself, don't know the answer to this question, and that's why we are here today. World Kidney Day is a global awareness campaign focused on kidney health. And I so much love the theme of this year World Kidney Day, which says kidney health for all, caring for the people and protecting the planet. So this is not just about human, but it's also about having a healthy environment, which in return will make human to be healthy. Distinguished ladies and gentlemen, sit tight with your pen and paper and get ready to learn about your kidney health from our expert speakers. First of all, without further delay, I'm going to be introducing our first speaker, and it is an honor to introduce our first speaker, Dr. Ngoka Stanley. He is a consultant physician and a nephrologist at the Federal Teaching Hospital, Owerri. Dr. Stanley Ngoka is the pioneer resident of nephrology at the Imo State University Teaching Hospital, Olo. He was also the pioneer senior registrar of nephrology in FMC Owerri and the first indigenously trained nephrologist in Imo State. Just like I've mentioned, he is currently a senior consultant physician and a nephrologist at the Department of Internal Medicine, Federal Teaching Hospital, Owerri, and the head of renal dialysis, and as well as the chief nephrologist at the Imo State University. He is fully registered with the Medical and Dental Council of Nigeria. He is a fellow of the West African College of Physicians. He is a member of Nigeria Association of Nephrology. He is a member of Africa Association of Nephrology, a member of International Association of Nephrology. He is an active member of the Nigerian Medical Association and a Knight of St. Christopher. Welcome, Dr. Stanley, and it is an honor to have you. You have the floor, sir.
Good evening, everyone. I indeed honored to be here. I want to thank the organizers, Professor Morris Wu, and everybody else that have found it necessary and found me, how would I put it, worthy to share today's topic once again with us. I don't know if you can see my slides. Can you see my slides, please? Hello? Can you hear me?
Yes,
Hello?
okay.
Yes, very well, Doc. We can hear you and we can see your slide.
All right. We would progress as follows. It's on full PowerPoint mode, right? I believe at this point. I want to be sure it's fully visualized by everybody. Just as earlier introduced, I'm Dr. Stanley Ngoka. I'm a consultant physician and nephrologist here in Owerri. This year's World Kidney Day took place on the 12th of March 2026. And this year's edition was particularly interesting in the sense that this year we are marking the 20th year in celebrating World Kidney Day. And we've decided that this year we'll keep our push for kidney health for all, caring for people, protecting the planet this time around. Quite a lot of influence from the planet, both positively and negatively, towards the kidney. Just as a quick reminder, that beautiful bean-shaped organ located behind, just at our back, protected by the lowermost set of ribs, measure about 11 by 6 cm with a thickness of about 4 cm. And if we look at the working apparatus, the nephrons, if you put them, nephrons are so tiny, they're like thread of the hair. If we put them all together, because the way God did it, each kidney should have between 800, thousand to about 1.2, 1.5 million nephrons. So if we put them up in series, we'll cover close to about 16 kilometers. So you can imagine that's existing as a filtration membrane and the kind of huge job that is being carried out. Some of the responsibilities of the kidney include filtration of blood. It's the responsibility of the kidney to, remove waste from the blood. And invariably, the reverse happens when the kidneys aren't working very well. Waste stays on in the body that are deleterious to the body, especially in certain volume and beyond the way God wants it to be produced. It is also the responsibility of the kidney to achieve electrolyte balance. Help produce certain hormones that towards the end, they begin to have persistent low blood levels. Furthermore, it is also responsible for activating vitamin D into calcitriol, which is essential for calcium metabolism. So if the kidneys aren't doing well, they have abundant calcium, they are not active, and they're useless. So, and you end up having, individuals with light bone, poor bone density, and high risk of osteoporosis. Now, having said all that, In summary, waste removal, waste and salt removal, regulation, the kidney does that. Acid removal, the kidney does that. Blood pressure control via renin, kidney is responsible. Protein production, it is the kidney as well. Activating vitamin D to keep bones healthy. And of course, prostaglandin production, which helps in inflammation, clotting, and menstrual cycle, and even in labor. Now, broadly, I always say this. Generally, we see kidney disease. Some we take care of, some we forget to.
See, I don't know if it's from my end. The voice is fluctuating. I suppose it's his network.
I think
Hello, can
so.
you hear me at all? Hello, can you still hear me? Hello?
Yeah, we can hear you now.
Yes, we can hear
Okay,
you.
is it better now?
It's
Is it
better
better now?
now. Yes.
Okay, so I think it was network. So, but then again, we always say acute kidney injuries are usually broadly divided into three. Pre, intrinsic, post. Pre are those the injury tend to occur affecting mechanisms that will occur just prior the kidneys itself, like reduced blood flow, excessive fluid loss, excessive blood loss, or maybe have heart failure affecting the kidney. That's pre-renal. Most times when you correct all those factors, a woman goes into delivery and it loses quite a lot of blood, and that blood not properly replaced, or had, or maybe a child or a young adult, unfortunate to have maybe a bowel infection in school and goes down with vomiting and diarrhea. It's not properly replaced, and the kidneys are shut down. That's pre-renal. Most times when you handle the toxins of fluid, anemia control, correct the heart failure, they get better. Intrinsic acute kidney injury are the ones that there are toxins directly affecting the kidneys. And it's a bit, for me, everything is important, but this particular type of injury is usually difficult to reverse. And most times when we say, hey, do everything not to get, we don't want anything that will affect the kidneys and leave a permanent scar. Toxins, infections, inflammation, all belong to this category. Even drugs that we use, like all these are NSAIDs and all that, bleaching cream, all fall into this category. Then the post-renal acute kidney injury are the ones that are caused from obstruction, and usually leading to build up in pressure post the kidney structure itself. We're talking about things like stones, maybe anywhere, bladder, uretras, maybe huge fibroids. We'll talk about them more as we progress. Now, but for chronic, we say chronic is if you have a kidney problem with evidence of damage more than 3 months, with a structural and functional abnormality in the kidney, whether there is rise or not of the, or rise, whether there's a decline or affectation of the estimated GFR, marked by It's either pathological abnormality, for instance, you see urinary sediments in the urine, you have blood sediments, you have casts, or there's evidence of damage, kidney damage, markers to that. It could be biomarkers, or you have even abnormalities in the structure itself of the kidneys. So by the time you're looking at the kidneys, they are either you have loss of maybe corticomedullary differentiation, or there's increased lipogenicity, which shouldn't be so. Once you have all that, you're dealing with a chronic kidney disease. Or when you have an outright patient who, by the time you estimate the IGFR, is below 60 already dealing with a case of CKD. Most times, you need to deal with this even for a much, much, much longer time. Now, chronic kidney disease it's also a global health impact. It's remarkable higher in middle and lower income countries, including Nigeria. The issue about it is out-of-pocket payment for health services, poor health-seeking behavior, unhealthy lifestyle, illiteracy, ignorance have all contributed to a large extent to worsening mortality and figures. Now, as we can see, estimates have shown that 1 in every 5 men, or even 1 in every 4 women, especially the ages between 65 to 74, have some form of CKD. And of course, as you get older, those figures also increase. Now, we've said it that the burden of CKD is so high that when you talk about death due to CKD, rising to as much as 90% from what it used to be years back, we should be worried and do everything to protect us. We talk about over 850 million people worldwide having CKD. So imagine the population of Nigeria. If we want to extrapolate our population to be up to 400, but twice that figure worldwide have CKD. And if left unattended to, and if not nicely intervened and with appropriate measures put in place, this usually leads to severe complications and, of course, premature mortality. And it's estimated that there's a worry that by 2040, CKD will become the 5th leading cause of years of life lost, highlighting the urgent need for global strategy to combat it. I hope we'll be all on this to slow down these figures. Now, there are different stages of CKD. Stage 1 being the best, stage 5 being the worst. Now, at stage 5, we're already talking about that the kidneys are very, very, very bad with eGFR less than 15. And from stage 4, yes, it's very bad though. From stage 4, we're talking about dialysis regularly. You almost need it that regularly. Stage 5, you can't do without dialysis. I will talk about transplant. So, but the good thing about CKD is that it's something that if picked up early, intervened early, most times you have very good outcome. Just to quickly go on, what are the symptoms that you may find in both AKI and CKD? We'll talk about reduced urine output. Yes, that may just be the initial worrying feature. But don't forget that the commonest clinical symptom of any individual with acute kidney injury or even a CKD is no symptom. So you may have a renal disease and not have any symptom. It may even be increased urine in the night. Maybe it's usually 2, 3, and all of a sudden you notice that it has gone up to like 4 or 5. There may be a problem with your kidneys. It might also be associated with generalized body swelling, tiredness, confusion. Then we talk about when you're talking about CKD and no longer acute, where you see blood and all those shortage of reduced urine output. You're not talking about recurrent shortage of blood. You now find out that even the body swelling that used to come and go stops reducing, and you probably need dialysis to even reduce fluid. They are unamenable anymore to tablets. You have both eye, brain, skin changes, and of course, poor quality of life. There are factors that can make individuals have chronic kidney disease. There are some factors that are non-modifiable that we cannot do anything about. For instance, our skin color. our ethnicity is an issue because there are even newer studies suggesting that for those of us who occupy this part of the planet, there are newer genes, like apolipoprotein 1 gene, that have been found to be related to CKD. So apart from the fact that as you get older, your kidneys begin to deteriorate, gender, more in male, ethnicity, which I mentioned, then those who are unfortunate to have been born with low, maybe they have maybe a low birth, small birth weight at birth, maybe premature. Most times we find out that they grow up with much reduced nephrons in number, and invariably they are predisposed to CKD happening much later. Then, of course, the modifiable ones, which we must do everything to make sure we don't potentiate. Tension, sugar control, whether you have proteins in your urine, you can do things about them to reduce them once picked up early. Then, of course, alcohol intake, smoking habits, then cholesterol issues, which have direct and indirect affectation of blood vessels and kidney deterioration, as it were. Then the presence of anemia, which puts much pressure on the heart, also may worsen renal function. Then our salt consumption, where it's salt. Are we still together?
Yes, no, but we lost you for a few seconds.
For a few seconds. Okay. All right, sir.
But we're
All
together
right.
now.
So the approach, what's the approach? Approach strategies to conservative management. What's the aim? We need to halt or slow down CKD progression by every means possible. Treating the various pathologies have been found to be a unique way of getting well at it. We need to also talk about appropriate utilization of dietary measures, taking steps to plan for long-term interventions if that becomes, and even follow-up. Then, so identifying major causes of CKD in the environment have been seen to be very key ways of slowing down renal disease progression. In the environment, hypertension is the commonest cause of CKD, followed by diabetes. Worldwide is the reverse. Diabetes is before hypertension. But in the environment, hypertension, then diabetes, then chronic glomerulonephritis, then HIV, then the inherited types of kidney disease is common in the environment. Then obstructive causes, obstructive nephroleuropathies from prostate issues, whether benign prostate issues or malignancies. We're beginning to see increased number of men with malignancies. So for the men, we need to be a bit more proactive. From 40, 45, start checking your PSA. You need to do a scan if possible. Don't just be satisfied with a normal PSA. Do a scan. Make sure your prostate size, shape, contiguity are all good. If there's any query, present yourself. Then we'll talk about fibroid. It's also not so nice for females who hold on to fibroid, especially when they are huge, to the point that they begin to put pressure on the route through which urine go out, the ureters, and even the bladder. Most times, by the time you now decide that you want to take it out, you're going to be left with battling with chronic kidney disease much later. Don't forget in that definition, it's not just a functional problem that we may have that may serve as part of our definition of CKD. We also have a structural problem. So once you have a structural distortion, even when your kidney functions are normal, you just have to stay on the edge and make sure that it remains normal by living a healthy life all the way through. Then stones are a very common entity. But because of the peculiarity of this year's topic and the need for us to begin to look at the environmental influence, potentiating even other forms of renal disease entities, we decided that, look, The environment plays a huge role, very huge role, in also making these kidneys stay good or stay bad. And it's very common in very high impact in low and middle income countries, especially agricultural and industrial workers. I'm going to be talking about them in a couple of minutes. We know that there's a link between, your ambient air, indoor air pollution, all that, with the contamination from the environment, the underwater, the run over water, pollution from industrial homes, all that will cause cause some form of kidney function impairment, which may manifest as AKI or a CKD. We also have issues with, the adverse effects coming from certain pathological means, where you have endothelial dysfunction, epigenetic modifications, and fibrosis all happening with oxidative changes and inflammation. All that are sequelae to this event. We're going to talk about that. All that would eventually lead to CKD. Now, as you said, mechanisms of environmental nephrotoxicity could come directly from tubular toxicity, especially from heavy metals and chemicals. This oxidative stress usually causes cellular injury that may be irreversible or non-reversible, especially when you have involvement of mitochondrial dysfunction. Once this happens in the renal tubules, it's almost very difficult for us to talk about reversibility. So what do we do? Begin to slow down. Because once there's chronic inflammation leading to fibrosis, okay, that's it. So therefore, recurrent ischemia from dehydration and heat stress even have been seen to be a major contributor to this environmental nephrotoxicity as we speak. Now, what are the heavy metals and kidney injury that can lead to kidney injury? Things from lead, cadmium, mercury, arsenic. These toxins usually accumulate in the renal tubules, and once there's tubular nephropathy causing chronic tubular interstitial damage, that's CKD already. Now, what are the sources of lead? Very, very, very common. Batteries. We handle them every day, either in machines, clocks, BP measuring machines, paints, industrial products, even contaminated water. They all cause chronic kidney disease. For those that may escape chronic kidney disease, cause hypertension. If not well handled, that will still cause chronic kidney disease. It may even just start as tubular interstitial nephropathy with structural features of CKD looking okay and nice. However, CKD about to happen. Cadmium, usually from cigarette smoking, contaminated food, packaging, industrial pollution, especially for those who are living in areas marked for industrial development. So you're very close to, cadmium the toxicity that will come from the water. Then you're faced with mercury toxicity from those same batteries and skin lightening creams. Even the way we handle our thermometer. That's why sometimes I get worried when you're using a mercury thermometer. You may find them leaking. You don't touch those things with your hand. Don't touch them with your hand. They have fungicides. All this can cause direct toxicity and cause renal cortical necrosis, which is almost irreversible. Very important, especially for those of our individuals that are into agricultural chemical handling, either in marketing or in utilization in our homes or farms. Sniper or tapiapia, scabicides, paraquats, and herbicides are all linked to kidney injury. So you must handle with care. Don't say you've been handling them for years. It's not true. You never can tell. That elevated urine creatinine may just be coming from progressive aliquots of exposure that you've had over the years. Organochlorines in insecticides like DDT are also not safe. They all can cause CKD, especially common in agricultural community. Very interesting, you may also want to know this, that toxic plants like OAC3, liquorized roots, Chinese herbal medicines, herbal supplements, especially whatever we do we must make sure that we screen for isocolic acid and make sure it's not there. Once it's not there, we're good. Aloe vera is very good. However, there's been a link associating aloe vera with tubular necrosis, humoral fibrosis, and you may not want to advise that people should take it in huge amount, especially when there's a suspected renal impairment already. Alfalfa has been linked to immune system activation. It's for those who use it, it's safe if you don't have a potentiation or propensity towards an immune-related disease. For instance, you have maybe autoimmune-related thyroid disease, or you had this recurrent skin manifestation, and they say, perhaps it's an autoimmune thing. It may not be wise to be on alfalfa. Then, of course, we know that insects for years have been implicated. Hello? Can you still hear me? Hello?
Yes, we can hear. I can hear you.
Yes, we can hear you, Doc. Go ahead.
All right. So
please, if you're not the one speaking, can you kindly mute yourself so that we'll have a smooth presentation?
All right. So we've had years of knowledge, and that group is expanding, where bees, hornets, wasps, scorpions, bites have been directly related to new onset renal disease, and we should avoid this as much as possible. So, especially from multiple things, toxin injection can cause hemolysis and what we call rhabdomyolysis, when the muscles are broken down. And when those muscles are broken down, they clog up the tubules in the kidneys, and AKI can happen. Then certain malaria have also been linked with kidney infection, kidney disease. Commonly in our environment is P. falciparum. Malaria cause quantum malaria. That's also been linked with malaria nephropathy. So what usually happens? It causes reduced blood flow to the kidney, obstruct those small microvessels supplying the kidneys, and eventually cause acute tubular necrosis. And if not initially properly handled, can progress to CKD. Now, of course, parasites like schistosoma, trypanosomiasis have all had one link or the other with CKD. And in areas where this is endemic, we must do everything to ensure that the volume of exposure to humans go down so that they won't come down with kidney disease. So what do? I've always said it. First, primarily, we must do early detection. Early detection is key. So it's not something you just relax. Once you begin to suspect that there's a family history of hypertension, family history of diabetes, so don't say it's your father or mother that usually have it and they had it at old age. Don't forget you're not, and there's a strong genetic link with any parent that has either hypertension or diabetes. So once your dad or mom is hypertensive, please, as early as you can begin to also check up yourself. Please do. Not too long ago, I had this very bad CKD patient that I've been managing for a while that eventually passed on. The day he passed on, everybody was wondering, this boy that just had CKD, where did he even have his CKD from? His BP was very bad. We're talking about BP 240, 140, 260, 140, 221. He was on like 4 to 5 antihypertensives. He was on dialysis. He eventually gave up to the renal disease. But the day the news broke out to the mom that the boy had died, we said, let us even check your own blood pressure. We checked the dad's blood pressure, it was 150/80. We checked the mother's blood pressure, was 200/120. So it's very possible that his mother had been hypertensive for years, and he was one that was unfortunate to have picked up hypertension. I didn't do anything about it. Only thing progressively led to CKD in end stage already. So it's good to do early detection. It starts from just examining yourself, make sure your blood sugar control is good, BP control is good, you live a healthy life, prostate is good. It's always said that once one has prostate disease, the offspring, especially as a man, you have sons. As you get older, call your sons and say, don't wait for the urine to stop flowing out. Go and be checking. So that if there's a need to start medication, to start medications early. Then to test them, it's not difficult. Basic urinalysis. Look for proteins in the urine. If they are not there, you can even do micro studies, what we call urinary albumin creatinine ratio, to check for microalbuminuria. The ones that normal urine analysis kits, Combi9 and the rest of them can't pick up. Urinary albumin creatinine ratio will pick it up. So if there's evidence of microalbuminuria, we can start early, either from the choice of antihypertensive or antidiabetic, or start early to begin to prevent you from having that. Simple thing as kidney function test, SUCR, serum electron urine creatinine, can just pick up early stage renal disease. Then, of course, if you want to go further down, you can do an ultrasound, which you should visualize the kidney and find if there are structural changes. Then, if it's questionable what the etiology may be, you can go further down. If ultrasound is not able to clearly say what the problem is, for instance, if it's a like inherited cystic kidney disease, like autosomal dominant polycystic kidney disease, that some of them that may look like a tumor, but they actually cyst, and the other forms of inherited cystic diseases that may look like autosomal dominant. So in those instances, maybe a good CT scan might help you visualize and help in the diagnosis of such an individual. But in instances where kidney biopsies are indicated, there's room for that. You do a kidney biopsy and it will help us say, this one is this particular one. Or we can follow up with the appropriate drug. So generally, based on the complications that you can expect, you can work towards that and take care of it. It causes uncontrolled hypertension. Once your BP control is good, it will slow it down. It causes shortage of blood. Your target is to ensure that your HB is between 11 to 12.5. You can do blood transfusion, do blood supplements, quite a lot of them. You can do oral or parenteral supplemented erythropoietin. Then, of course, bone mineral diseases make your bones weak. I had mentioned a bit about it. I talked about uncontrolled hypertension, like the patient I gave an example of. And sometimes, if blood pressure is not well controlled, can actually cause a heart failure. So imagine you have a renal disease, no heart failure. If your BP is not well controlled, you have a heart failure in addition to CKD. It can even be the reverse. That whole link between the BP, heart, and the kidney, we all call that renal syndrome. So you could have the heart failure and have a kidney disease afterwards, but you can start with the kidney disease or the heart failure eventually. Of course, malnutrition. Most of them don't eat well, so you need to do extra so they won't have going to poultry energy malnutrition and the rest of them that may eventually worsen and make mortality figures go up. So exercise, be on good kidney-friendly diets. I mentioned this last year. Watch your salt intake and eat healthy. Plant proteins are good. They are of high biological value. Red meat you should slow down red meat. In fact, as you get older, you should just barely know that you should slow down red meat. Do more white meat. White meat is safer. When metabolized, puts less work on the kidney. Exercises are the type that the emphasis is help you maintain weight, but don't put more stress on the kidneys. As if people do a lot of work. Sometimes I know that it's good to do exercises and do some work, but don't do the work that by the time you go from your house and you're halfway along the road and you wish you could just take an Okada and go back to your house. Why did you stress yourself from the first place? Do distances that you can manage. You do them regularly. You're not going for an Olympic. So because you end up forgetting that you need to take water, you could hurt yourself more than the reverse that you're trying to get. So do distances, go at your pace. You don't have to go to a gym. You can exercise in your house. Then you watch your weight. Portion control is good. Blood pressure control is good. Glucose management is good. But just to mention, for those who are diabetic and are listening, you need to get worried if at any point in time you notice that those medications that you were using for your sugar, all of a sudden they begin to make you have low sugar. you should be worried. It might just mean you could have developed a kidney disease. Don't think the diabetes have gone on. So what do? Just simply do a kidney function test. If it's okay, thank God, then you slow down reduce your medications and just do mostly diet. If you notice that your E&U is going up, please see a physician. Then, of course, avoid nephrotoxins. Don't be in the habit of taking NSAIDs. Bleaching cream, of course, I know, not just cream, even soaps that contain bleaching agents are also not good. Then, of course, I'll leave the best of the herbal things to the experts. They know the ones that will tell us. Because I know that we're in a forum where the best of this is available. So if you must choose the best. Then, of course, more specifically, ACIs, ARBs have all been found. These are forms of antihypertensive. There are so many of them, and I'm sure we know most of this. The target is take care of your blood pressure. If you need to take more than one BP medications, please do. Make sure you take things that will reduce proteinuria, because they say the presence of proteinuria increases the mortality. So once we can slow down proteinuria, mortality gets better. Same for dyslipidemia. So once we take care of our cholesterol levels, then we're doing good. Then, of course, for women, once you notice that your kidneys are beginning to misbehave and they're showing signs, you slow down. You don't try as much as possible to reduce on your desire to have that many children. Just to quickly round up, I've mentioned a few of these in passing. Fluid intake is key. The target is, see the weather, 3 to 4 liters is our recommendation. Please do more if you can, but certainly don't do less. Less is only advised if, for instance, unfortunately, you have a kidney disease and you're already beginning to retain fluid, then the teaching is slow down your fluid intake. If your legs are dry, your press is dry, please drink as much water. The excess will be eliminated. Because don't forget that because of sweating, breathing, fluid gets lost from our skin. So and by the time you add the one that evaporates from the skin and mouth while you're breathing, and you add that we lose from urination, they now actually know the real amount that goes back into the body and helps maintain body hemostasis. So if you don't give excess, say imagine what little water is eventually getting to the kidneys, which might encourage a shutdown. That's why for people who live in very hot environment, the northern part of Nigeria, the middle bit, the north central zone, then people who live in who are Caucasians and live in the Middle East, if you travel without recourse to taking lots of water, can hurt your kidney. Then, of course, I've talked about target control, anemia, improve calcium control. There are things to do. There are drugs available, vitamin D containing calcium, and meds are super good. We've talked about watching your salt intake and the rest of them. Protein intake, but they say that the salt intake should be just a pinch and keeping it between less than 4 grams. Some people say less than 2 grams if possible. Then, of course, studies have shown that increasing alkali-inducing fruits and vegetables diets help to reduce renal injury. So, I'm sure the experts will draw more on this. But this is advice. So once you can do that, then, of course, when you do your kidney function test and you realize that your potassium level, particularly, is above the upper limits, some say 5 millimole, some say 5.5. Please slow down on fruits that are rich in potassium: banana, plantain, pawpaw, carrots, and tomatoes. So it's not about taking them every day. You need to also be checking. You need to check intermittently to be sure that you've not also gone overboard. Once you've gone overboard, you slow down. After a while, it normalizes. There are a few instances where we need to intervene, either by giving medication or even take the person to dialysis, especially if the kidneys are not working well. But if your kidneys are going to be excreted, then I've talked about this earlier on. For me, alcohol should be minimized as much as possible. No binge drinking, avoid smoking. Don't be in an environment where you take smoke secondarily. That alone can affect your kidney. Then, of course, there are options. If you do all this and the values are still very high, dialysis, we have lots of dialysis centers in the environment. both public owned and privately owned dialysis centers. And in certain areas, the type of dialysis, not hemodialysis, you do peritoneal. Peritoneal is where the exchange takes place directly in the peritoneal cavity in the stomach. Hemodialysis is what we commonly do, where blood is used as a medium of exchange. Then there's something called CRRT, continuous renal replacement therapy. It's a form of hemodialysis, but for more moribund patients that have cardiovascular decompensations or disabilities that may not be able to sustain regular dialysis because of their cardiovascular state. So this is what typical hemodialysis machine looks like. That man is having dialysis. Then, of course, when you do all that and you notice that things are not probably getting better because of the fact that maybe they're already in stage 4, stage 5, renal transplant solves all problem. And renal transplantation is done in this Nigeria. So for those who are asking, are we doing? Yes, please. I'm telling the entire world. We do now. We are trying. We need more help, more collaboration. But we're doing good. We have quite a lot of figure in terms of renal transplantation being done in Nigeria. So, and of course, you can never overemphasize the need for healthy diets, and it says as a preventive measure. Please go to your doctor, talk to your colleagues who are your friends, and live a healthy life generally. So, in conclusion, ladies and gentlemen, and noble professors and learned listeners, the importance of understanding this disease is to, especially kidney, as it were, is to improve awareness. We've talked about the different types. We improved our knowledge base. At this point, our aim is to ensure that we live a life that is going to help those kidneys better. So when we ask that person, are your kidneys okay? We can categorically say, yes, they are okay. Thank you. Thank you, everybody, for this opportunity. Thank you for listening.